Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. And the second half of the program is going to be living a longer and healthier life. And we have, as promised, Lou Biasi, Vice President of All County Healthcare, with us today. Lou, you're looking great. You losing weight? What's going on?
Well, David, I have to lose weight because my knees are hurting me so bad. As you grow older, you get these knee pains, you get torn meniscus, and the doctor says you got to lose weight. So I'm trying, and I'm eating your brownies. I'm eating your diet brownies all the time.
Paleo brownie bites.
David's right taking the brownie bites. I'm eating those brownie bites of yours, David. Thank
Love
you.
Katie Cakes. I'll give them a shout out.
But I want to thank you for having me on, and we're going to talk about home health care. What is home health care? Who's entitled to home health care? How do you get home health care? And why you should have home health care. One of the things that we do at All County, we've been in business for 25 years. And what we basically do, we do the respite custodial through a sister agency, and we do the clinical. There are two differences. One is basically all clinical, where you send the nurses in, the PTs, the OTs, all the specialty services that you have. The other is respite and custodial care, where a patient might just need some home health aid in there to help her with her bathing, with her ADLs, which is called activities for daily living. Now, as you grow older, you have a choice. I always say, you're once an adult, you're twice a child. You come in as a baby, and if you live long enough, you go out as a baby. And I'm experiencing that right now. And Matt even had to help me up because, my knees are getting hurting. I just had stem cell replacement. Mm-hmm. Hopefully that helps, right? There are all kinds of new things are coming on. And that's what you should know about. That's why we have this show. What's new out there? What's new for the seniors? The seniors, little by little, a lot of stuff is being taken away from them. They have a lot of these physicians now are starting with these ACOs, these MSOs. A lot of managed care is coming in. And poor seniors, they really don't know what they have. You say, well, do you have Medicare? Yeah. But then you find out they have managed care because they have what they call Medicare Advantage. The Medicare Advantage plan it's a great terminology, Medicare Advantage. Mm-hmm. Well, it's an advantage as long as you don't need it. Need care. But once you need care, it's a disadvantage. So when the government gave you something back, and when President Kennedy and Johnson signed this bill into the Social Security Reform Act, where they give you a Medicare at 65, or if you're totally disabled, you're entitled to Medicare. You paid for it all your life. And my answer is stay on. If you're listening to this program and somebody's trying to say something different, say, listen, I want to stay on straight Medicare. I paid for it all my life. That's where the government spends 99 cents in every dollar in medicine. Mm-hmm. So the answer is, if you got something that the government is giving you that you're paying for, And when you need care, the care is going to be there. If you have Medicare, Part A and Part B, any hospital in the country will take it. Any hospital in the country will take Medicare. That means if you're in Texas, you go to MD Anderson for cancer. If you want to go to Cleveland Clinic, you can go to Cleveland Clinic. When you're on an HMO and a Medicare Advantage plan, you don't know if they're going to take your plan or not. So the answer is, if you got something that universally it's accepted by every doctor, every hospital, that's what you want to stay on. And when you're on Medicare, one of the provisions was that when you are 65 or you're totally disabled, Medicare says you're allowed home health care. Meaning if you have surgery, a hip surgery, well, Medicare will kick in and they'll send a PT, an OT, a nurse to your home. That means as faster you get out of the hospital, the better you are. You don't want to stay in the hospital too long because there's a lot of, as people heard about these, a lot of MRSA going around.
Infections.
A lot of infectious disease going around.
Well, is it true the hospital wants you out as well?
They want you out.
Yeah, because they have a certain criteria that they have to hit.
Right. So the fact of it is, if you have a hip replacement, a knee replacement, or open heart surgery, you want to get home as fast as possible to avoid this idea of MRSA or infections. Once you get home, you're in your own environment. I always feel if you're home, I think you're going to heal better. Okay? Mm-hmm. And at that particular time, whatever company you select, one of the things is, if you take home care is your choice. Not the doctor's choice, it's your choice. You can choose any home care agency you want. And I'm happy to say All County Healthcare has a 4.5-star rating with Medicare and a 4.5-star rating with ACA. We worked hard to get that 4.5-star rating. And if you heard some of our nurses on our commercials, and listen, me being a senior, one of the things I tell my nurses, if the patient needs 15 visits, you give them 15. If they need 50, you give them 50. Whatever they basically need for visits, you give them until they heal and basically their outcome is satisfactory where you can discharge them. Home care means that you can stay on for 60 days. That company can keep you on for 60 days. That means you get therapy for 60 days, you get nursing for 60 days, you get occupational therapy for 60 days. And after the 60 days is up, if you feel as though you're progressing and you still need more, they can do what they call a recertification and put you on for another 60 days. So it's unlimited what you can get when you're doing Medicare home care. If you're with an HMO, and I'm not knocking HMOs, but I'm not very pro to them either. Mm-hmm. I mean, the company will have to call. They might authorize 2 visits. And every time they had the 2 visits up, they have to get another authorization. And sometimes they won't authorize any more visits. So the chances are right, because everybody today is trying to save money. We at All County Healthcare, we're not trying to save money. We're trying to heal you so that you can have a better quality of life. That's the reason we sponsor this program. Thanks to David, who brings in the physicians. We're trying to let seniors know what's out there so that they can primarily have a better quality of life. And if any time you don't know, if somebody tries to sell you something different and you don't know what it is, please give me a call. Call my office at 954-717-7027. Salesmen will come out and try to sell you a Medicare Advantage plan. They'll tell you, oh, this is free, that's free. How do I know? Because my mom, when we first started this thing, my mom got on a Medicare Advantage plan. Well, there was no advantage until I found out what happened, and that's how I got into this business. My dad got sick, came down with dementia. We needed a home health aide. We hired a home health aide. I ended up acquiring, becoming the vice president of the company. I thought what a great service it was. And today we've progressed for 25 years. We've gone from a respite custodial care company. We also have that division, and we also have a Medicare company. And the Medicare certified company, we're ACH certified, and we just got our survey, and I'm happy to say we passed our survey with flying colors.
Nice.
That's unbelievable, right? Yeah. And all the new changes that kept coming down the road with Medicare. So if you think you're going to need home care down the road, right? It's your choice. The doctor might say, see, sometimes the doctor knows somebody or is a friend of somebody, the medical director, somebody says, I have this home care agency I want to use. It's up to you. And sometimes you don't know, but it's your choice. And I'm going to tell you one thing. We're the only company right now in South Florida that can help stop the readmissions to hospitals for respiratory disorders such as COPD. We've invested in multiple home units that you get. The unit is in a hospital. A lot of times, COPD you're never going to cure. But we don't want you to keep going in the hospital every 15 to 20 days for respiratory. All County Healthcare is the only company, I say this seriously, it's the only company that's invested in what we call IPV units, interpulmonary percussive ventilation units. And if you want to, if you think you have COPD, or you know you have COPD, or you have respiratory disorder, tell your doctor you want to go to All County Healthcare, and you want to try their IPV unit, right? And if you go to our website, David, give me our website.
It's allcountyhealthcare.com. Also, we've had a lot of Facebook live questions come in tonight, so that's just all you do is on Facebook, you just type in All County Healthcare INC or facebook.com/All County Healthcare, and you can get all the shows there. If you ever need to go back and look at a show, that you've archived all the shows on your site. So thank you for that.
Hospitals are calling us right now. They say to me, Lou, can you help us stop our readmission? Readmissions means a patient goes into the hospital. He's discharged. 15 days he's readmitted for the same problem, COPD or respiratory. That's becoming amazing problem for the state of Florida. All over the country, the readmission rate, that means it's costing the government more and more money. It's costing hospitals more and more money. So if you're suffering from COPD, you got a nebulizer, you tried all these other treatments, make sure, go to our go to our website, look up our COPD, call us, right? Tell your doctor that if you qualify, that means one of the things you have to be is what they call homebound status. The nurse will make a determination, the doctor will make a determination for homebound status. Now listen, homebound status means that you can leave home with assistance. That means you can go to doctors, you go to the hairdresser, you go to church, you go to shopping. But you can't go out there and play mahjong every day or cards every day or be on the road every day. But if you're homebound, that doesn't mean you have to be bedridden. That means you basically have to leave home with assistance. Then you might be entitled to basically home care. Home care comes with your Medicare Part A. There's no charge to you, no out-of-pocket charge to you, no copay to you. It's basically it's a service that is provided you by Medicare. As you grow older, you're entitled to home care. Why do they want home care? Well, it's cheaper for them to have you at home than it would be in a hospital.
Isn't it correct the working force pay for the Medicare for our elders?
Well,
in a way, that's the way it's set up.
Medicare is taken out of your paycheck every single. Your Social Security, your paycheck.
Correct.
You're still paying for Medicare.
Oh, even that's
Social Security,
right.
You're still paying for Medicare.
Correct me.
So
Thank you.
why not use it? If you're paying for it, use it.
Yeah, if you got it.
And somebody's going to say, you don't have to pay for prescription drugs. You don't have to pay for this. You don't have to pay that. Well, as long as you're healthy, guess what? You don't even need insurance. Mm-hmm. But once you get unhealthy, what's your choice? And I have more people calling me, I thought my mother was on Medicare. Well, she switched. See, what happens from October to December, people change,
Open enrollment, I think
open
it's what
enrollment
it's called.
And all the word. Now, if you look at TV, the Humanas of the world, and I'm not saying they're bad, the AvMeds of the world, the Uniteds of the world, they all come on TV and they say, join this, join that, join that. They spend millions and millions of dollars on TV. You don't see one ad for Medicare. Not one ad. Why is that? Because you're looking for one company is for profit, which is the HMOs, and another company is for nonprofit. Well, I'd rather be with somebody who's going to spend more money on my care than a company that's for profit, and they want to make their profit, spend less money in care, and worry how much they're going to make. So the answer is, if you have a problem and you're undecided what to do, or you don't know what your policy is, call me up. We have a gentleman by the name of Sandy Jacobson. Sandy would come out and see you and tell you if you're eligible to go on Medicare right now, and you need a supplement. I recommended Sandy, and I don't sell supplements, but Sandy Jacobson is an expert in it. He does a lot of
He's been on the show twice. We try to get him on every quarter.
And he tells, I think everybody he's been to, everybody says, what a wonderful man. He's honest. He's this, he's that. And Sandy will tell you what's the best program for you. So if you need help, you can call David at the station. You can call me at 954-717-7027. If you have any questions, you can call our office, talk to one of our case managers. Again, that's 954-717-7027. They'll explain it to you. If you want to get to me, just tell them I heard Mr. Biasi on the radio. Please, could you have him give me a call, and I'll get back to you the same day or the next day. I answer all my calls, right? So again, if you have COPD, or you have a family member that has COPD, or a respiratory ailment, please go to our website. It's becoming a major, major problem today. As you see the ad, you see the big elephant sitting on the man's chest. He has COPD. He can't breathe. His quality of life is fading. Guess what? Call us. Let's see if we get you a better quality of life as you grow older with the COPD. There's many, many commercials now on with COPD and respiratory disorders. Along with that, we do it all. We do the nursing. We do the PT for therapy, for occupational therapy, physical therapy. If you have hip surgery, knee surgery, cardiac problems, if you just basically, there's many, 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 many disciplines that you might have that you're not sure of that might require home care that we can help you with. Now, even med management, if you have problems with your medication.
I just want to go back to COPD for a second. I did some recent research on COPD. It's the third largest killer in America. In the United States.
Besides cancer and heart.
Cancer and heart are first two, right. And then COPD, which stands for chronic obstructive pulmonary disease. Right. So it's when you have...
That affects your heart, too.
Oh, yeah. So start shutting down your whole system.
Right. So the fact is, if you have COPD, right, we made a major investment in helping seniors with this. And please, try us. Call. You have nothing to lose. Try us. It's 954-717-7027. Go to our website.
allcountyhealthcare.com, and you can bring an IPV machine into the home that actually breaks up the congestion.
Congestion, right. If you get a lot of excretions that you can't get up, that's what we do.
Now, it's not only smokers are getting this. People with secondhand smoke can get COPD later in life. People who've worked in environmental, like sandblasters, worked in construction.
Well, you see a big ad, to see that big ad where people with the asbestos problem, right? Mm-hmm. Yeah, I mean, there's billions of dollars left for asbestos problems, right? Which might be a form of COPD. There's many ways that if you qualify for our IPV unit, let me tell you, you're going to experience a tremendous, tremendous relief in recovery. That you're going to have some kind of normality. We've had people on oxygen. After our treatments, they got off oxygen. We've had people that don't want to, that just look forward to the treatments because they can feel better. They breathe better, right? We had one couple, right? The husband was on oxygen. Middle of the summer, we gave him the treatments for 11 treatments. He got off his oxygen. He was 84 years old. He went in the pool. He swam, came back, made love to his wife. The wife called us, said, "Hey, I want to buy that machine."
That keeps you healthy.
How
quality
can it be
of life.
that, right? It's good quality of life. See, you're still not too old, but at 84, right, if you have COPD and you can't go up and down the steps, this might be one of your solutions. We're not saying it'll work for everyone. We'll say good chances that it's going to improve your condition tremendously.
Lou, we have about 30 seconds. I'm going to be really quick with this. I want to call all pulmonologists in South Florida. Please come on this show. You and your doctor living a longer and healthier show. Tuesday, 6 to 7, or Friday, 5:36. I'll welcome you. Any organization. Check us out on allcountyhealthcare.com. Lou, thank you.
One other thing. Hey, do we have a second?
Yeah, you got 15.
Okay, 15 seconds. Listen, if you have a doctor that wants to come on the show, bring him on. Call David. We'll get him on. Thank you very much. Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.